health discussion, and it's been a wonderful month of enlightenment and, of course, learning, as we have Professor Baderinwa Adewale, who I would say our in-house acupuncturist now, because he has been a reservoir of knowledge. It is great to have you, sir.
Thank you
are
very
welcome.
Much. It's nice to be here once again.
Thank you so far for a wonderful month of knowledge that you've been giving us. Well, we have something quite interesting this morning.
Yes.
And we're discussing sciatica.
Yes.
Now, this is a problem that, in fact, everybody at one point in time around has come in contact with this problem, even if not permanently, at least, depends on whatever you do and all of that. Well, let's start exactly with the definition. What exactly is sciatica?
Let me put it this way. A lot of people always have this misconception. From my own clinical experience, if you come to the clinic, I've been having pain on one side of my leg. I don't know if I've sat on juju or I've matched juju. You know, we Africans, we have this kind of belief and all these things. So basically, sciatica, let me put it this way, is the other name for sciatica is sciatic neuritis. In other words, when the sciatic nerve, which is a principal nerve from the buttocks going to the leg, that nerve is called sciatic nerve. And when it gets to the middle of the leg, it gives rise to some branches like the peroneal nerve and the rest of them. Or sometimes maybe if you are injected, maybe the nurse mistakenly injected you on a wrong site, the first place is going to attack is the head of the sciatic nerve. And that's why you see a lot of people after that, they will be dragging their leg, because the thing has already impinged on the sciatic nerve. So sciatic nerve is that nerve that arises from the buttocks to the leg. And when it is now being inflamed, or when there is an herniated disc, or when there is a kind of problem, the patient will come up with some constant pain on that part of the leg. It will be constant in the sense that even when you use an analgesic, within a while, the effect will die down, the pain continues all along, and that's why a lot of people always ascribe it to witchcraft and all these funny beliefs, So
now this pain, what causes this pain? You've mentioned it, one of the causes and all that. What other things can cause this pain in the sciatic nerve?
Well, herniated disc can cause it. Then if you are the type that's always sitting in one place, you don't move around, it can also cause it. Or probably if your occupation involves using the waist, and along the line, you might have sat wrongly, and then some of the bones in the sciatic region could be impinging on the nerves. And that kind of pain will radiate to the lower legs, and it will be constant. And in that case, there could be what we call sciatica.
How about age? Does it come in to consideration?
Well, basically, when you are within the age of between 35, 40, and 50, you can start experiencing this, And if you are a sportsman, depending on the kind of sports you do, like people who do aerobics, they move their body a lot. Along the line of moving, or you are a weightlifter, part of the bones could have shifted one way or the other, and it could affect that nerves. And that's why you see a lot of weightlifters, they have to give them this
belt.
This belt to strap the lumbar from moving anyhow, because any slight movement can affect, can generate that kind of pain, which could be constant.
Right. But before we talk about curative measures, how about preventative measures or preventive measures? In this case, is there anything you can do to prevent?
Yeah, one of the things to prevent is by exercising regularly when you move your body. And then, of course, you can go for some regular massage. Massage is good. But when you are going for massage, you have to be careful, because I want to say it on here. Majority of the people doing massage today are not even properly trained. A lot of them believe that massage is just about putting olive oil in your body and start scrubbing. No.
I know, this is a personal experience. Someone I know that has not had any sort of professional training or anywhere, just because his hands are strong.
Yes.
The guy just, like you said, olive oil or something. Your hand
when
strong.
You do that, you are going to cause problem for your patient. You are going to irritate some nerves, and you are going to rupture some blood vessels along the line. Massage is not about strength. It is about what you have in your head. And that is why massage has been described as the systematic manipulation of the soft tissue for relaxation or for therapy. So when you are not trained, definitely there will be mistakes. So if you have sciatica, you go to people like that, you're going to create more problems. So the best thing to do when you have that kind of problem, number one is you will take analgesic, which is very common. Just take, because sometimes mild analgesic may quell it, provided it's not sciatica, because sciatica pain is very stubborn.
Yeah.
But sometimes it goes on its own.
On its own.
But it's better you seek for medical attention when it is giving you problem, because I've suffered from it once. I was unable to sit very well inside the airplane. I have to, you know, you have to strap your belt.
Yeah. I
have to be, you know, and the air starts, what's the problem? You know, until I get it treated. So in other words, in order to treat it, the first step is taking your analgesic, and don't just take analgesic anyhow. Let it be prescribed by a qualified medical practitioner so that you don't cause more problem. Then apart from that, you can use your ice and cold pack. This is talking about physiotherapy.
Yes.
Take ice, put ice there, you know, and when you use ice for the first 24 hours, then you can now start treating it with a warm compression, things that can generate some heat. It is not good to always start your treatment by using hot.
Exactly. I just wanted to ask that question. How do you know where to get the balance between the cold and hot?
When you have pain, the first 24 hours, you should use ice. After 24 hours, you can now start applying all those hot stuff. Because I know a lot of people, once they have pain, the first thing they will go for, I don't want to mention that product, it's very popular around us. They will go and buy it, and they will be scrubbing
we know it. Let's mention that aboniki. Is it
aboniki, you know, so that would not be good. We've seen a lot of people who have just a strained ankle, and they use aboniki. The next day, the leg will be as big as this, because that is a wrong approach. The first approach, the first 24 hours is ice. And that is why there is an acronym, RICE. RICE means rest, ice, compression, and exercise. You first of all apply ice. When you do that and you take analgesic, the next day you get up and there you go. But if you go and apply those wrong treatment, the next day they will be making tea and salad for you in the bed, and you spend so many days there, you know. So the approach is very, very important. And now, how does acupuncture comes in? Acupuncture is the best way to deal with sciatica. And what do I mean? There is a particular acupoint here on the gluteal region. This is called the gluteal region. On the lateral aspect of it, this is the point here. It is called GB30. The name for it in Chinese is Wan Tiao. Wan Tiao. You know, in this point, you are going to use a long needle. This needle is not long enough. The needle has to be about 5 cm. You will insert it here. When you insert it here, you know these are gluteal folds. When you insert it here, the needle must touch sciatic nerve because it is lodged inside there. When it touches it, you will see a sensation of vibration on that leg. That means you are there. So when you do that, you can now have some additional point like full waist, on colon and all this point. You had it. So what we are saying in essence is, don't start indulging in drug. If you have taken your analgesic and the problem is not abating, you may also consult the physiotherapist if there is a nearby physiotherapist. Or better still, see an acupuncturist. Acupuncture will take care of it decisively, for sure.
Wow. This, you just entered into the place when you started calling the names and all of that. That is quite something.
Yes.
But, Prof, it has been such an enlightening month with you. So much so. Once again, just finally, I knew you mentioned it last week. How do we get qualified acupuncturists? How do we know that the people who are doing it are qualified and not quacks? Where do we get that information?
Yes. Number one, if you want to get good acupuncturists, we have a body in Nigeria which is called NUCAM, which happens to be the Deputy National President, Nigerian Union of Practitioners of Complementary Alternative Medicine. Okay. We have a lot of acupuncturists there. Then the Medical and Dental Council has registered some acupuncturists in the country, including some of these expatriate acupuncturists you see around. But I tell you what, it is better you see Nigerian acupuncturists, because some of these expatriate acupuncturists can't even express themselves in English. And you know, in medicine, diagnosis is very important. When you are conversing with a doctor that doesn't hear your language, there could be misconception and there could be ambiguity. But when you speak to somebody who understands your language, or in most cases, you express it in your native language so that he knows what is wrong with you. You will be able to go right to the point and do justice to that problem once and for all.
Professor Baderinwa Adewale.
Thank you very much.
Such an honor, such a pleasure. Thank you so much for imparting all your knowledge throughout this month.
Thank you.